Because of the extreme stigma experienced by people with mental health issues, many are reluctant to speak publicly. But as we hear in this next segment, it is through telling their own stories that the community can gain recognition, understanding, and compassion.
Because people need to know that there really is still a very stigmatized thing about mental health, and people go, oh, that's a person with a mental health issue.
As far as stigma goes, it's probably something that almost all people who have had mental health difficulties has experienced.
And it can really cause lack of self-esteem.
And it doesn't make me a monster or a weirdo or a schizo.
We all use things like crazy and loony, or we call people aschizophrenic.
People think that if you have a mental health issue, that it means you belong in an insane asylum and that you're going to be in a hospital and all that.
Rarely do I really talk openly about it.
Part of my getting over my self-stigma about mental illness is to talk about it and to tell my story.
We tell our own stories.
We tell our own stories.
We tell our own stories.
I was hurting, I was in pain, I was in a dark place, I couldn't communicate. When you're psychotic, it's basically like you're living in another reality that's not real. It's like a science fiction movie. For me, it's been that way. But the problem is I believe very wholeheartedly that everything around me is real.
I've been chronically depressed for, have had chronic major depression for over 25 years. It's just been a part of my life. Mental health issues and depression just drain you. They drain you. Even subconsciously, if you're having an okay day, it's working on you. And it's exhausting. Depression is exhausting.
When I first started, I was homeless. I was without housing for 3 months.
Everybody that I know of has had difficulty in their lives. The only difference is in the matter of degree. And, they don't get so depressed that they're completely disabled.
How do I define, or what do I think of when I hear the word well-being?
Well-being to me is basically it's a state of mind, but it's also kind of a spiritual state too, maybe. You could say where everything can be at rest and happy with what's going on now.
So, and I don't think there can be real well-being without a sense of ownership of your life. I'm doing pretty well now in my life, and I wouldn't have been able to get to this state of well-being by myself. Welcome to the Wellness and Advocacy Center. This is a drop-in mental health center for anybody who has experienced mental or emotional distress. Come on in.
So when people walk through the door of a place like the Wellness and Advocacy Center or Interlink or the Russian River Empowerment Center or the Center in Petaluma, people are greeted with a lot of warmth and compassion and acceptance, that there's something about talking with somebody else who has been in a similar situation that can often be really good medicine.
Being seen as a peer, being seen as a friend, being seen as a member is much more human than being seen as a patient.
I can sit and empathize with you, but I can't really say, well, I've been there. But peer-to-peer, they can go, oh yeah, I know, that's what I deal with. And so peer-to-peer support, I think, is super important because you're talking to someone who's actually been there.
I love your drawing. It's beautiful. What we do here, what we have here is invisible. We think about how many suicides have not happened because people found their way here. How many crimes out of desperation have not happened because people found their way here. I never knew that there was such a thing as recovery. And I didn't really know that there was such a thing as help available.
If you find out someone has a mental health disability or a problem, don't give up on them.
It does take motivation, it does take work. You can't just give up.
Being proactive and, you know, seeing a doctor if you need to, going into a program if you need to, getting on meds if you need to. It's only now that the government and society and people are really starting to go, oh, okay, it's just like having a physical affliction like a heart or kidney problem.
Just keep on going, you know, don't go back to the past.
God is a big part of my life, and I do have a faith, and that's been able to sustain me.
What works for me is friends, music, movies, you know, keeping it real. Breathing is good. Meditation can help sometimes if I can do it, you know, it's so tricky. But I do yoga. In some ways, I feel like I'm on the path to recovery. I don't feel like I'm recovered, but I'm working on it every day.
There is not only one story.
There are many stories.
If there is only one,
Then it's a stereotype.
We are not a stereotype.
We are not a statistic.
We are part of the community.
We are grateful to everyone who told their story here.